Welcome to another session on Ask Me Anything related to breastfeeding your babies. Myself, Dr. Tanima Singhal, and I welcome you all for yet another powerful session where we'll discuss about your questions, and I'll try my best to answer them as best as I can. So let me start first by taking the questions which are already there on the Google Sheet, which you have filled on the Google form. So first question is from Tanima Bhattacharya. My 6 months old daughter doesn't breastfeed at all. Will I have to pump as long as I want to give her breast milk? So since your baby is just 6 months old right now and you have started pumping, and as soon as your milk supply starts improving, just try for the baby to come on the breast and be in regular. I know that you are under consultation of one of my doctor, so just continue following whatever they are advising. We also give protocols related to bringing the baby directly on the breast also. So just be under their guidance, the way they are telling you about how to try for different types of tips they are giving you on bringing the baby on the breastfeed directly. So just work on that. And anyhow, just keep one thing in your mind, that your baby is getting breast milk. Don't worry about the quantity, how the baby has been given, what is the mode, how's the baby given. Main thing is the positivity that you are giving your baby your breast milk, even at this age of 6 months. So all the best and don't worry about anything. Just keep moving. Right now, don't think about, will I have to pump as long as I want to give her breast milk. The breastfeeding journey takes lots of different curves and different kind of ways. So just right now, don't focus too much on the future. Right now, work on the present and be happy that you are at least trying, you are able to give your baby your breast milk. That is the most important part. Okay. Next question is from Himali. Himali says, can we mix expressed milk in different pumping sessions? If I get 60 ml at one pumping session and baby needs 120 ml, then can I mix the milk of two sessions and give it to my baby? Yes, you can definitely do that. So what is the basic principle here is that suppose you have pumped whatever amount of milk you have pumped in the morning, and then you are again pumping some amount in the afternoon. Now, what you can do, you have both the ways out, that you can give the amount of breast milk which the baby takes, and if the baby takes more, you can give formula milk after half an hour. Or if the baby becomes too hungry and doesn't suffice on 60 ml of milk at one go, then what you can do, you can give one time of formula, one time of the two times of milk, and you can give it to the baby. And as the milk supply starts improving, your baby's weight starts increasing, then what you can do, then later on the formula milk will start decreasing. And don't worry that if I am giving formula milk 120 ml, I need to give the same amount of breast milk. You know, breast milk has there is a lot of elements about nutrition also in the breast milk. Every mother's milk is different, and even it keeps changing as per the baby grows. So breast milk composition will keep changing as per the mother's body and the way she keeps on working on demand and supply. So even not necessary that 120 ml of milk will be required every time. Maybe the baby will take only 90 ml or 60 ml at one go. When I'm talking about breast milk or formula milk, and the baby will be suffice. How you can know about it? By seeing the weight gain of your baby. So if your baby is gaining weight properly and the formula milk is coming down, then you don't have to worry about maintaining the same amount of milk which you have been giving till now. So I recently had a case where the mother was giving around 120 to 150 ml of formula milk every feed. Once we started working, then whatever amount of milk she was pumping, she started giving to the child. The baby was not coming on the breast. I think the baby was around 7 to 8 months. So the mother was giving her the amount of breast milk. So in the previous session, when we started, then what happened in the initial days, she was a little apprehensive that my child used to take 120 to 150 ml. So she used to get whatever amount she used to get, and she used to give top up with the extra amount of formula milk. But the weight gain was going beyond what we wanted for that child. So we started reducing the formula milk per session. Initially, the mother was little skeptical because she thought that my baby's nutrition will go down. But we convinced because the baby's weight gain was good. So if the baby's weight gain is good, then it is perfectly fine to reduce the formula milk. We need to maintain the weight gain, that's all. If the formula milk is coming down and baby is gaining weight, we are perfectly good to go to reduce the formula milk. So don't worry about the amount of breast milk or amount of formula milk is if it is going down. You just need to check the baby's weight gain. If the baby's weight gain is good, then you can definitely go. It's not a problem about how much milk you are expressing. Next question is from Toshi Mehta. Is it okay if your baby suddenly starts to fuss while feeding and especially over a specific side? Yes, this is very common. So I have made a lot of videos. So just to inform all of you that I am regularly making some short slides or videos which you people are regularly asking me. So I'm trying to put all those because many times I see that the questions are repeated by the mothers. So I'm trying to take all the questions and making small short form videos so that the mothers can get more. And a few months back, I also took a poll on the email that what kind of videos do you want? So many of you wanted small, crisp videos so that the answers, I understand with small babies, you don't have a lot of time to watch bigger videos. So I've started making small short form videos. You can check it on my YouTube channel. There I'm regularly putting short form of videos for the regular questions which the mothers are asking me regularly. So you can have a look. So this about suddenly starts to fussing, I have answered that question also recently. So you can just have a look. Otherwise, it is absolutely okay. It is okay. The baby is adjusting. The baby is trying to adjust to the environment. So it's okay. Specifically, just see, Toshi, if the baby is around 2 weeks, 6 weeks, 3 months, 6 months, or 3 months, 6 months and 9 months. No, 3 months, 5 months, and 7 months. If the baby is around these months, that is perfectly fine because these are the growth spurt of the baby. So baby will fuss around these times. You just need to have patience and just have a lot of skin to skin with your child. And specifically, if only one side is the baby is having this kind of issue, just try doing more massage in the compress and try to do little more expression sessions so that maybe the milk, because if the baby is not comfortable on one side, we usually as mothers, if the baby is crying, we put them on the side where the baby is more comfortable. So the side where we are not feeding the baby regularly, the supply goes down. So right now you can create more demand that side. Try to put the baby on the breast at that side and try to pump on that side if the baby is not coming on the breast. It will be okay, Toshi, don't worry. Next question is from Mathi. My baby is 62 days old, birth weight 2.9 kg, current weight 3.16 kg. For increasing weight, 2 weeks before you suggested to take hind milk after every feed, but I could see only few drops of hind milk. Could you please provide advice to increase the hind milk? So there is nothing like you can increase hind milk. It is basically the nutrition. You have to improve your nutrition. So let's just me take so 2.9 kg and current weight 3.16 kg. So this is 2.9 and 3.1. Okay. So this is only 200 grams. Okay. So 200 grams. It's 62 days. Baby just gained 200 grams. Okay. No. So Mati, the weight gain is what I'm seeing here. 62 days when I see, then the weight gain is very less right now. So for increasing weight 2 weeks before. So 2 weeks before you started working on this, what is the weight gain in last 2 weeks when you have started working? That tell me that, Mati. So in 2 weeks, if the baby has started gaining 200 grams per week, so which I don't see because 2.9 and 3. This is only 200 grams weight gain which has happened from birth. So Mati, please don't wait. The baby is 2 months old and has gained only 200 grams. This is not good, Mati. Please reach out to the lactation consultant. Just reach out to the team. And also I'm putting, just give me 1 minute. Many of you are asking after that consultations on the calls that how to reach out to you and all those things. So I am just putting one link here. So this is, I'm putting two links basically. One is the link for consulting me and other link is to consult our other doctors, lactation consultant doctors. So if you're in an emergency, you can reach out to my team and like the other doctors. And suppose you are thinking of planning to work with me, you can book my consultation. So the link which I have shared right now is for my team of doctors. I'm just sharing my link also in case you want to work with me. So this is link. So please save these links anytime you are planning to have a consultation, you can book it. This is like, you just check out and just save these links in case you are planning to have consultations with any of us. You can contact us because after the consultation, I get so many mails about sending the links. So this time I'm sharing during the webinar itself so that you have the links in handy with you. So Mati, what I see here, the baby has gained only 200 grams in last 2 months. This is not good. Please reach out to the team and get your consultation booked and work fast on hind milk to start increasing. Maybe we might need to add formula milk because the baby's weight is very less. The weight gain is only 200 grams in 2 months, which is not good for the health of the child. So Mati, we need to work on this fast and we might need to add formula milk for a few days if we don't start seeing weight gain, because this is a big lag. We needed nearly 61.6 kg and we have got only 200 grams. So we need to cover up this fast. So please, Mati, don't wait further. Next question is from Deepika. Latching issue and increased breast milk. So for increasing breast milk, few things which I always suggest the mothers is, first of all, creating the supply and demand chain. So if your baby is on exclusive breastfeeding and you are not pumping, but you are giving formula milk to your child, but the baby is coming on the breast, then in that case, every time you breastfeed the baby and you need to give formula milk to the child, that time don't give full formula milk, give some amount and then latch the baby again. Just keep doing this regularly, create more demand. If your baby is not coming on the breast at all and you are giving only formula milk to the child, or you are expressing the milk and giving it to your child, then you need to pump regularly as per the demand of your child so that the milk supply starts increasing by improving the demand. Now, this is one part which is called as demand and supply. Second, to support the body, we need to have a good amount of hydration. So have at least 3 liters of water. Regularly do massage in the compress so that the flow of the milk is improved. Third, the galactogogues, which I suggest, the natural ones I suggest as lactomagic powder and Morico tablets. These are 100% natural with no preservatives added into that. So whatever kind of galactogogues you are using at your home, whatever powders or whatever tablets you are using, just check that they don't have any preservative. Just look at the back and you can see some preservatives are added into most of the items, most of the products which are available in the market. So just make sure there are no preservatives. And minded preservatives are basically what I commonly see as parabens. So parabens are not safe for consumption. You can see a lot of ads coming these days in the market about preservative-free shampoos, preservative-free creams. When they are not good for local use, you are a new mother who is feeding your child. So you don't need to have preservatives in your diet. Basically, it is not good for human consumption overall. And because being a new mother, it is not advisable for you to take any kind of preservatives. So any kind of powders or any kind of tablets you are using, just check the back of it. It doesn't have any preservative added into that. So the things which I suggest is lactomagic powder and Morico tablets, which are 100% natural with no preservatives added into that. So you can consider thinking, think about it and consider using it so that you start seeing some results there. If you feel that you need to have some galactococcus. So when I talk about increasing breast milk, these two things are what I recommend. Next is lot of skin to skin cuddling with your child. This will help to bring your child on the breast back if your baby is not coming on the breast. So lot of skin to skin, lot of cuddling with the child. Even when you are giving bottle feed to the child, just hold the baby close to you as you are giving your milk to the child. So the basic concept, why am I suggesting this? When the baby gets habitual to the bottle, they just want to have independent breastfeeding. Now, when you're taking them on the breast, when you're putting them on the chest, when you're holding them close to you, they get more bonded with you. So that way it will be helpful when we are trying to get the baby on the breast. These are all the primary things which we need to start doing right now itself if you are planning to get the baby back to the breast. So this is one thing. And last thing is checking the weight gain of the baby. If your baby's weight gain is there regularly, what we do, we start decreasing the formula milk slowly. So if the weight keeps on increasing even after decreasing the formula milk, we are good to go. We don't have any issues about how much milk you are producing. That is not a concern until unless our formula milk is coming down and baby's weight is increasing. So these are the two most important parameters when we talk about how to check whether the milk supply has improved or not. If the baby's weight is increasing and formula milk is coming down, that means we are good to go. As you can imagine, as the baby is growing, so baby's demand is increasing. The formula milk should increase. But if the formula milk is decreasing, then the weight should come down. So if it is not happening after decreasing formula, if the weight is coming down, then we are on the correct path. Just don't lose your faith and trust in any kind of things. Just keep moving on that. Once you do persistent efforts into that, it will definitely reach you. You will reach your milestone where your formula milk will come down, and you will just the baby's weight will keep increasing. And it doesn't matter how much you are producing. Sometimes mothers are just pressing the breast and they are feeling nothing is coming out. Drops are coming out. They are pumping and they see only 10 ml, 20 ml milk coming out. That is not a concern. If your baby's formula milk is coming down and baby's weight gain is there, you are good to go. Don't worry about how much milk you are producing or how much milk is there. The milk production changes throughout the day. It might be more in the morning, less in the afternoon and evening, maybe again more in the evenings or night. And it may change as mother to mother. We mothers, because we have a lot of work. Many of you are second time moms, many of you are third time moms, many of you are new moms. Many of you would have got very good care during pregnancy. Many of you would have not got very good care during pregnancy. Also, it depends what are the nutrition demands in your body. What is your requirement? Maybe you require more nutrition. So that will all regulate the milk supply. The basic thing is about how much your baby is gaining weight. So please trust yourself, trust your body. Just keep checking the weight of the baby and the formula milk start decreasing slowly, slowly. If the weight is increasing, you're good to go, girls. Okay. So Deepika, this was about breast milk and about the latching issue. So what I suggest for latching issue is the cross cradle hold. So I would again bring in tell for all of you. I tell in every webinar, and this also I am telling you how to hold your baby. First, be comfortable, sit straight, don't bend forward. It will put a lot of pressure on your spine. So sit straight, have pillow below you, and then put the baby on the pillow. The baby should be turned towards you. The baby should be looking at you. Now, if you have to feed from the left breast, hold the baby from the right hand and hold the breast in U shape from below. Now, press the breast so that a pout of areola comes out. Now, if you have inverted nipple, flat nipple, small nipple, long nipple, nothing, no, not at all a problem. Just hold the breast in U shape from below and press the breast. Now, when you're bringing the baby from the other hand, just make sure the baby's head is little extended. When the baby's head is little extended, the chin will first touch the breast, and the hard part of chin will give a regular compression on the breast, and it will help in good flow of the milk in the baby's mouth. So just make sure the baby's head is little extended. Now, when you are bringing the baby on the chest, with the thumb, just make sure that you rub the nipple on the baby's upper lip. So the baby will open the mouth. If you need to just keep patience there. If the baby is not opening a wide mouth, just be patient there. Just put the baby there and just like take back and forth, back and forth. So the way like you're teasing the baby and not giving the baby the milk. So once you are doing this, the baby will open a big mouth and then take the baby inside and make sure that the head is still extended. Once the baby is inside, then extend the head again by just twisting your wrist. Just twist the wrist so that the baby can look back, and obviously the nipple will be pointed towards the upper palate of the baby, and that will ensure a deep latch. So just work on this, Deepika, and latching issue and increased breast milk both will be resolved by these. Next question is from Jasween. Why is there pain in one of the breast while feeding? Good question. So Jasween, basically if you are having pain on only one side, then remember, we all humans are basically one side brain dominant. We are more comfortable feeding our baby from one side. It happens for most of the mothers. So what happens if we suppose we are more comfortable with the left breast? Now, babies don't give time many times. They just start crying and we just get panicked and we just put them on the side where we are more comfortable. So suppose you are feeding the baby more on the left side. Obviously, because right side, you are not regularly putting demand on the for milk supply, the supply will start going down. Now, if you put the baby on that side, the baby will need to have more efforts. The baby will not find enough milk, so baby will try to suckle it harder, and it might cause pain to you. Also, maybe you are more comfortable on the left, on one side of the breast where there is no pain. So latch is good that side. On the other side, you are not very comfortable. So your hand position or the baby's position is not coming fine. So just work on the latch and it will be, I suggest that you reach out to my lactation, the latching expert, and she'll just correct your latch on the side where you are having pain. So I've given the links in the chat box about my other doctors. So there, if you just make a payment from there, you will be directed and then you will get a form. So in that form, you just fill only latching issues. So our latch expert will reach out to you and she will have a call with you and she will try to resolve your issues related to pain on only one breast. Next question is from Shweta. Shweta says, if the child is bottle fed in the initial months, can it be possible to breastfeed the child again? So yes, of course, when you people are like doubting you all these things, just think of one thing. Why is the baby not coming on the breast? Just think about it. Just think about it. Why is the baby refusing the breast? First of all, flow. The flow with the bottle is more what we are having on the breast. Second, and because they're habitual to the fast flow, they expect the same thing on the breast. So if the flow of the bottle is more than the breast, they will start, obviously as humans, they will start preferring the bottle because the flow is fast. You get more milk there. Third, if the gaps between the feeding sessions are more, so if the gap between feeding sessions, the baby becomes so hungry that the baby doesn't cooperate on the breast for a slower, lesser flow. Fourth, when they are more independent with the bottle, they are more comfortable with the bottle. And when you try to hold them close, they just want to resist and they want to go away. They just push very hard. They push the mother and they want to just get rid of it. So all these things are important when we are talking about the why the babies are not coming on the breast. So now what we need to do, we need to have a lot of skin to skin, lot of cuddling with them. For every feeding session, we need to put them on the breast. We need to feed them frequently, not letting them become very hungry. We need to see the hunger cues so that we can work on them. Next of the thing is that we need to have the paste bottle feedings. So if you are using the bottles where the milk is dripping by itself, obviously the flow is very fast. The baby has got habitual to that. So try to have the paste bottle feeding, and if possible, your baby is less than 1 month or 1.5 months, try to wean off the bottle so that the baby starts coming on the breast more properly. And last, keep patience. Just be patient about it. It's okay. It's okay. It's okay. Don't worry. It will be okay. Just give consistent efforts and believe me, universe will help you. Whenever just think about it, if you are working in one direction diligently with all your heart and mind, the nature will definitely help you. It will never happen that if you are trying for something very hard, nothing will happen. So you need to just trust on yourself, trust on your body, and please trust on Mother Nature. Mother Nature will never go wrong. It will help you, but you need to be positive. You need to attract positive. I see mothers most of the time just worrying, ma'am, nothing is happening, ma'am, nothing is happening. And if you go detail, if you talk to them, then you will see there are many missing points that they are not able to follow. Because to follow everything properly, you need to have sanity, you need to have patience, you need to have peace. And you're not able to follow the things because you're not peaceful from here. So the most important thing is just keep patience. It will be okay. It's okay. It's okay. It's okay. Just keep reminding yourself, yes, I am doing it good. I am doing my best. I am working on this, and definitely I'll get results. So you need to be very positive when you are talking about breastfeeding. Breastfeeding involves two lives. One is yours, which has got changed suddenly. Suddenly, so many responsibilities. Suddenly, so many expectations from people. Who taught you to become a mother? Nobody. So give yourself time, be gentle on yourself, be gentle on your body. It has gone through a big phase. You have delivered a life, you have brought a life in this world. So be proud of yourself. Just don't keep doubting yourself. Oh, my milk is so less. My baby, I am not able to produce. You just keep feeling so pity about you. Just remember the beautiful creature you have called, the beautiful child you have brought. The whole family has changed. So give yourself some time. And when you accept yourself, then you will start having peace. And then you will start following the things which are recommended to you, which are told to you. Okay, so please don't lose hope. Don't leave patience. Just keep working, girls. You're doing so good. I'm so proud to each and every mother, because the way they come to me or they come to my doctors and they talk to them, I can understand what you're going through. Being a mother myself, I have two kids and I know the things what goes through. And believe me, even after knowing all these things, I went through the same phases during my postpartum period. So I can understand. I don't push very hard, but I always say that you can do it if you are peaceful from here. Okay. So, Shweta, your question was that if the baby has been on bottle fed, can the baby, is there possibility to breastfeed again? Yes, definitely. But you need to improve the flow, you need to improve the supply, and obviously you need to have a lot of cuddles with your child. Next question is from Noshin. Does soft breast means milk supply is low? No, nothing like that. So, good question, Noshin. So, mothers feel that if the breasts are not too tight or if they are not so engorged, then breast milk is less. Or sometimes they say that after feeding, I just press the breast and it is so soft, I feel there is no milk. So it is not like that, girls. So breast has lot of globules in it. It has it can store milk. Now when the baby is born, your brain doesn't know how much milk will be required for the child. So in the initial few weeks, there is let down more. There is more prolactin, so that the engorgement happens if you don't feed the baby regularly. It is the nature's way of maintaining the supply and demand. Once a baby has grown some things, now if you are giving formula milk to your child, your brain doesn't know that you are giving formula milk to the child. So whatever amount of milk the body is producing, it will keep producing the same until unless you do something like to improve the supply and the demand. If you don't do anything, it will keep producing the same amount of milk it has been producing. It doesn't know now that your baby is taking formula milk. So that's why softness of breast. So after some time, your brain will understand that this is the requirement of the child. So that much amount of milk will be produced by your body. So softness of breast doesn't mean that you don't have enough milk. It all depends. If you want to increase the milk supply, then you need to work on the supply and demand and the other parameters, which I always tell in each and every webinar of mine. And still, if you feel that you need more help, I understand it looks everything okay. It is possible. But sometimes when we start doing it, we feel nothing is working. Basically, what I see that mothers need more hand support, like hand holding there. Somebody to ask them every time, how was your last week? How much, what happened? Listening to their queries, because babies, they are a separate life. They are a separate human being. So they might not behave in a way what you are expecting from them. So sometimes they are more crying, some days they are more hungry, some days they are more sleeping. So full week has passed where there are a lot of questions. And that is the role of the doctor there, of a lactation consultant doctor there, to discuss your issues. Maybe you're not following any, not having any problems, but you need to have somebody who can listen to you, who can guide you, who can tell you where you are missing the things. So this is the importance of having a mentor who can guide you, girls. So, Nausheen, coming to your question, soft breast doesn't mean that your milk supply is low. Next question is from Sahana. My baby is 3.5 months old, but she's not gaining weight even with lot of efforts. Please suggest me the solution. So if your baby is 3.5 months old, please see that what is the weight gain of the baby first of all. So your baby should gain around 100 to 150 grams in a week. If she is not gaining weight this much, then start after every feed, just check the color of the milk. If the color of the milk is thick white, try to express and give it to your child. The baby will get more hind milk and the milk supply, so the baby's weight will start increasing. Even after doing this, if the baby's weight is not increasing, please focus on your nutrition. Have lactomagic powder and Morico tablets that will improve your body's nutrition, and obviously you will start seeing baby's weight gain with that. And also do some warm compresses and massages which will improve the flow of hind milk in the baby's mouth. And lastly, keep checking the weight. If your baby is gaining 100 to 150 grams, you are good to go, Sahana. No worries with that. Next question is from Preeti. Hello, ma'am. I am following the mid-bottle feeding protocol. My question is how to know if baby is satisfied with the feeding. My 3-month-old baby seems happy after direct feeding or falls asleep after about 10 minutes of active feeding on each side. But again, he cries in about 20 to 30 minutes and takes full bottle. He cries with mid-bottle too. I am not able to understand if he's taking breast milk and how much. That's okay, Preeti, but what is the weight gain of your child? So your 3 months old baby, this is very common. As I had told you, at 3 months, the babies have growth spurt. So frequent feeding is very common with them. So what is the weight gain of the child? If you are live here, please tell me the weight gain of last 1 week so that I can I can understand if the baby is getting enough or not. So please just write in the chat box if you're live here, what is the weight gain of the baby? Preeti, I need to remember because sometimes you ask questions, you answer there if you're live, and I'm not able to connect whose question was that. So if I'm asking something right now, to write in the chat box for a thing, and if the question was in the uh, please just mention that in your answer also, that my question was in the Google sheet. So I'll just refer here to the Google sheet and I'll answer your question accordingly. Next question is from Anjali. What is the solution for flat nipples and engorged breast right after delivery, which causes problem in breastfeeding? So for first of all, there are two things: flat nipples and engorged breast. So imagine now, if you just imagine the breast, the nipple is a projection. Now, if the breast is engorged because you have told just after delivery, so what will happen? If the breast is engorged, the nipples will become flatter there. Second thing, if the breast is engorged, if the baby will come on the breast, the baby will be slipping. The baby will not be able to hold the areola properly. The baby will keep slipping because it is so engorged. Third thing, flat nipple and engorged nipple. When we engorge breast, for engorged breast, what is the solution? You need to do regular warm compresses and massages and put the baby regularly, frequently on the breast, because right now, just after delivery, the baby's obviously the stomach capacity is very less. So they will take frequent feedings. So just try to put them on the breast frequently so that the engorgement goes away and it gives a good signal to your brain the baby is requiring milk and the milk supply will be maintained. For flat nipples, don't worry about it. Just follow the cross cradle hold. In today's webinar, I have just answered how to have a good latch with the cross cradle hold. For just after delivery, cross cradle hold works very well. And Anjali, I suggest that if you are not able to resolve this issue within a week, don't wait further. Reach out to the team, get your consultation with the team, and get your issue resolved. Because if there is no point in waiting more than 1 week, your baby is just delivered, you can resolve the issue very fast. Next question is from Soumya. My baby grunts and pulls my nipple while feeding. Please suggest what I could do. So if your baby is grunting and pulling the nipple, it means the flow is less or the supply is less. Just try to do regular warm compresses and warm oil massages, and try to improve the breast milk supply. Today I have given lot of tips about how to increase. And specifically, if your baby is habitual to bottle feeding, they might do that in the initial days. So just keep patience, just try for mid-bottle feedings and try for after feedings, and it will be okay. And just try to hold the baby, lot of skin to skin and cuddling, so the baby gets more bonded towards you. Next question is from Drisha. Why is there soreness on nipples and at times in pains as well? Also, Lo is latching it properly. So many of you think that my baby is latching properly. So there are a few pointers which I want to tell you to see if the baby is latching well or not. First of all, a bigger mouth opening, first of all, so that the baby gets a bigger portion of areola in the mouth. Second point is chin should be touching the breast. Third, the lower lip and upper lip are averted outside to have more breast tissue in the mouth. Fourth thing, the baby's head is little extended so that the nipple is pointed towards the upper palate. Last thing, when the baby is suckling, you can see the gulping movement in the baby's neck, and you can see the cheeks are going like like they're feeling the fullness you can see in the cheeks. If you're seeing dimpling in the baby's cheeks, that means the baby is sucking air and the latch is not that deep. So all these pointers you need to see, Drisha. And I am very sure something might be missing. Soreness on nipples will be only there if the latching is not correct. So Drisha, just see these points, and if you can see any of the points are missing there, and you have soreness of nipples, reach out to the latching expert, because if you don't work on it fast, the soreness will change into many times wounds also. So cuts and a lot of problems with that. So if you are not able, like if you are seeing that any kind of things which I just told you are there, reach out to the latch expert and get your latching improvised. Next question is from Shreya Elsa. I have started your treatment protocol since 3 days. I get hardly 10 ml when I pump. I am yet to start the medications. If I decide to give baby, she's completely rejecting the breast. What to do? It's just 3 days, girl. So don't worry. Just follow the proper protocols for 7 days. Reach out to the expert. Have your next call and get your issues resolved. It is just 3 days. Just keep patience. What I can say right now, and keep moving forward with full enthusiasm and full positivity. Next question is from Eman. Before having medications, I just wanted to ask, medications पे dependent तो हो जाएंगे या छोड़ने पर भी मिल्क आएगा? So ईमान, हमको पहले समझना है कि हम मेडिसिन क्यों यूज कर रहे हैं. हमको पहले ये समझना है कि मेडिसिन का रोल क्या है. मेडिसिन का रोल बेसिकली खाली हमको सप्लाई डिमांड के टाइम पे जब हमको डिमांड क्रिएट करनी है अपनी बॉडी में, तो मेडिकेशंस हमारे न्यूट्रिशन स्टेटस को इम्प्रूव करने में हेल्प करती हैं. अगर आपका न्यूट्रिशन स्टेटस ऑलरेडी अच्छा है या होता अभी तक, तो आप मेहनत आप ऑलरेडी इतने दिनों से कर रहे हो, ऑलरेडी कर रहे हो ना इतने टाइम से. तो अगर वो इम्प्रूव, अगर आपका बॉडी का न्यूट्रिशन स्टेटस ऑलरेडी अच्छा होता, तो अभी तक ऑलरेडी रिजल्ट आ गए होते आपको. अगर कुछ मिसिंग है तो हमको एक साथ सब चीजें करनी है. अब कई बार आप लोग कहते हो कि मैम मैंने सब कुछ ट्राई कर लिया, मैंने ये भी लिया, मैंने वो भी लिया. मैं समझती हूँ आपकी बात, लेकिन आप ये सोचो ना कि अगर आप जैसे एक एक व्हील है जिसके बहुत सारे स्पाइक्स हैं, आप कभी एक स्पाइक चलाते हो, कभी दो स्पाइक, तो क्या आपका पहिया घूमेगा? नहीं घूमेगा. आपको एक साथ सारे स्पाइक्स एक साथ चलाना जिससे आपका पहिया तेजी से घूमना शुरू करे. शुरू में आपको एफर्ट्स लगेंगे, लेकिन अगर एक बार वो चलने लग गया तो आपको सिर्फ हल्का सा मोमेंटम देना पड़ेगा उसको. अब आपने जो पूछा कि मेडिकेशंस पे डिपेंडेंट तो नहीं हो जाएंगे, तो आपने अपनी बॉडी को जब वो थोड़ा सा स्टार्टिंग में आपने पुश दिया, आपकी बॉडी ने मिल्क प्रोडक्शन या मिल्क का अमाउंट बढ़ाया या उसका क्वालिटी इंप्रूव हुआ एंड बच्चे का फॉर्मूला मिल्क कम हुआ. यहाँ पे एक और चीज क्या है ना, मदर का कॉन्फिडेंस जो अपनी बॉडी पे आता है कि हाँ अब मेरा बच्चा को फॉर्मूला मिल्क की रिक्वायरमेंट नहीं है, बच्चे का वेट गेन ठीक है, फॉर्मूला मिल्क खत्म हो गया, तो मेडिकेशंस की डोजेस को धीरे धीरे करके टेपर करते हैं, टेपर करके उसको खत्म कर देते हैं. नो मेडिकेशंस, आप सिर्फ सप्लाई डिमांड के साथ आप आगे बढ़ते हो. लेकिन इस जगह तक पहुंचने के लिए आपको बीच का रास्ता तो लेना ही पड़ेगा. आप स्टार्ट कहीं से कर रहे हो, अगर आपको मंजिल तक पहुंचना है तो बीच में आपको कोई चीज का तो हेल्प मिल लेना ही पड़ेगा ना, जिससे आप जल्दी पहुंच जाओ. आपको यहाँ से अगर दूसरी सिटी जाना है, आप पैदल चल के जा रहे हो, आप बस से जा रहे हो, आप कार से जा रहे हो, आप स्कूटी से जा रहे हो, ये आपका डिपेंड करेगा ना कि आप कितना जल्दी पहुंचना चाहते हो. अगर आप जल्दी पहुंचना चाहते हो तो ये सब चीजें आपको हेल्प करेंगी. मैं ये नहीं कहती हूँ कि बिना मेडिकेशन के आप नहीं कर पाओगे, लेकिन ऑलरेडी एक 6 मंथ्स का टाइम हमारे पास होता है. 6 मंथ्स के बाद बच्चा खाना खाने लग जाता है. एनी हाउ ब्रेस्ट फीडिंग तो हमें कंटिन्यू करनी ही है, मगर जो 6 मंथ्स का जो बेस है, जो हमें अपने बच्चे को एक अच्छा बेस देना है, उसका टाइम हमारे पास बहुत कम होता है. उसमें अगर हम ये सोचते हुए निकाल देते हैं कि ये लें कि ना लें, ऐसा करें कि ना करें, डॉक्टर के पास जाएं कि ना जाएं, शायद मैं खुद ट्राई करके देख लूं, शायद कुछ हो जाए, तो मैं आपको यही बोलूंगी 1 हफ्ता कर लो. बहुत है अगर करना, 1 हफ्ता कर लो. 1 हफ्ते में अगर रिजल्ट्स नहीं आ रहे हैं, प्लीज टाइम वेस्ट मत करो. रीच आउट करो टीम को, जल्दी जल्दी फटाफट रिजॉल्व करो. और मैं आपको बताती हूँ, क्योंकि मेरे पास ऐसे मदर्स है जो 2 साल में 2.5 साल के बच्चे के मदर्स मेरे पास आते हैं, वो बोलते हैं मैम हमको किसी ने बताया नहीं कि ऐसा कुछ होता है, लैक्टेशन कंसल्टेंट कोई होते हैं. आप लोगों में से कितने लोगों ने सुना था कि लैक्टेशन कंसल्टेंट कोई होता है? आपके घर में किसी ने बताया था क्या? अरे अभी पता चल गया है तो उसका फायदा लो ना, जल्दी जल्दी फटाफट काम करो ना इसके अंदर. क्यों, क्या सोचने में निकाल रहे हो? आप जो बच्चे को फॉर्मूला मिल्क दे रहे हो, क्या वो सस्ता है? महंगा आता है. एक डब्बा 3-4 दिन में खत्म हो जाता है. दूसरी चीज, क्या वो हेल्दी है? आपने कभी सोच के देखा कि फॉर्मूला मिल्क का सोर्स क्या है? किस चीज से बना है आपका फॉर्मूला मिल्क? फॉर्मूला का नाम ही है फॉर्मूला मिल्क, वो सिंथेटिक मिल्क है. अगर आप सोचते भी हो कि किसका सोर्स है उसका, क्या गाय का दूध का सोर्स है, तो क्या आपको लगता है कि हमारे पूरे वर्ल्ड में इतना गाय का दूध है कि बड़ों का भी पूरा हो जाए और छोटे बच्चों के लिए भी डब्बों में बन जाए? है क्या इतना इतना गाय का दूध या भैंस का दूध या किसी भी एनिमल का दूध? तो इतना नहीं है. जो भी है वो सब सिंथेटिक है जो आप दे रहे हो अपने बच्चे को. अब उसके अंदर भी ऑब्वियसली आप पढ़ के देखना, इतना छोटा लिखते हैं ना कि आपको पढ़ने में भी नहीं आएगा कि आपके डब्बे में क्या लिखा है. ऑयल्स पड़े हैं उसके अंदर, क्या क्या चीजें डालते हैं. आपका बच्चा इतना छोटा है, हम हर चीज पे इतना ध्यान देते हैं कि बच्चे का कपड़ा एकदम सॉफ्ट होना चाहिए, सॉफ्ट कॉटन होना चाहिए, उसको सारी हम अच्छे से अच्छा उसके लिए करना चाहते हैं. बट उसको जो अंदर जा रहा है उसके बारे में हम सोचते भी नहीं, क्योंकि ऑब्वियसली हमारे डॉक्टर ने हमको एडवाइस कर दिया था, हमने सोचा डॉक्टर ने बता दिया था तो अच्छी ही चीज होगी. आप खुद सोच के देखो, और डब्बे को प्रिजर्व करके रखना है तो उसके अंदर प्रिजर्वेटिव डालेंगे ना, क्या दे रहे हो, केमिकल्स अपने बच्चे को। तो इतना जब दिमाग लगाते हो कि मेडिकेशंस लूं कि नहीं लूं, ये फॉलो कि नहीं करूं, रिजल्ट आएगा कि नहीं आएगा, डॉक्टर के पास जाऊं कि नहीं जाऊं, खुद ट्राई करके देख लूं। अरे भाई, इतनी सब चीजें सोचते सोचते कि टाइम निकल जाएगा। ये बहुत इंपॉर्टेंट टाइम है। वो इमेजिन करो कि एटलीस्ट पता चल गया ना, अभी टाइम लीज पता चल गया तो फॉरेन रिजल्ट्स के लिए काम करूँ ना तेजी से। ठीक है। तो ईमान, फिलहाल आपका मेडिसिन पे कोई डिपेंडेंसी नहीं होगी। एक बार फॉर्मूला मिल्क जीरो हो गया, बच्चे का वेट गेन हो गया, आप प्रॉपर्ली कॉन्फिडेंट हो, मिल्क मेडिसिन की डोजेस कम कर दी जाती हैं, बंद कर दी जाती हैं। Next question is from Chandrakala. Baby is 3 months old. I am exclusively pumping and feeding. After your consultation, I started direct breastfeeding, but my baby sleep within a minute, and if I feed bottle, she refuses. I am worrying about it so much. Please help me. So, Chandrakala, if your baby is coming on the breast and sleeping after some time and rejecting the bottle, just tell me what is the weight gain of the child. So, Chandrakala, just write in the Q&A box what is the weight gain on one week, and let me know and remind me that my question was in the on the Google sheet. Next question is from Kirti. After every feeding session, baby is demanding more milk. The whole part of the areola is inside baby's mouth. So why this happens? Something feeding is very painful. My baby is 2 months, 20 days old. So first of all, Kirti, you don't have to give whole areola in the baby's mouth. You just need to give only the lower part of areola. So we never suggest whole part of areola. So if you're trying to push the areola in the baby's mouth, the baby will start refusing because the baby's mouth is not that big to have full areola. So in that case, the baby will refuse, and there will be a like kind of fighting between you and your child. And that time the baby might do it harder feedings and you might feel painful. Also, when you're giving whole areola in the baby's mouth, the baby is getting stuffing inside the mouth. So that will not help. So just try to have lower part of the areola in the baby's mouth. The upper lip of the baby should be resting just above the nipple. So this way you just need to have about this, and definitely will be okay. If you are feeling very painful and it is not resolving, then reach out to the latching expert and she'll help you with that. Next question is from Gunjan Sharma. Still not coming on breastfeeding. What that does mean, I'm not able to understand. So if your baby is on formula fed or on bottle fed, I'm not knowing the full question. Write the full question. Next question is from Ankita. Namaste, ma'am. Please explain skin to skin. In winters, it is difficult to that open chest to chest, even with a blanket on. What are the things we can do to get this done easily, and how much time is sufficient every time? Good question again, Ankita. So I can understand skin to skin becomes difficult in winter, especially when it is very cold. So what you can do, just if your first thing, if your room is cozy, if the door is not opening again and again, and the room is very good, warm and cozy, then you can do skin to skin with your child comfortably. No worries with that. Second, if the room is opening again and again and your room doesn't remain so warm, and if it is like not too warm or cozy, then you can skip the skin to skin part. When you are feeding the baby on the breast, obviously you are bare chest. Just open few buttons of the baby and just try as much as you can keep. Otherwise, don't worry about it. Whenever you are just feeding the baby, just hold the baby close to you, and like whenever the baby is sleeping, just hold the baby close to you. That's all for now, that way. And once the weather starts improving, then you can have skin to skin with your child. No worries with that. What all things you can do whenever you're giving bottle feed to the baby, just hold the baby close to you and give the bottle. Whenever you are breastfeeding the baby, you are already bare chest, just try to hold the baby close to you. That's all you can do for now. Next question is from Sampa Mondal. Breastfeeding low supply, but my baby is of 3 months. My breastfeeding is not increased with after many efforts. So Sampa, I have given today a lot of tips about increasing breast milk, but you need to work for it. Only I give you 1 week to work on it. If it is not improving, I suggest, and I strongly suggest that reach out to the team. Don't work by yourself. It will not help. You need to have a proper guidance. The guidance, why it is so important, because somebody will keep asking you, how is everything? How was your last week? So you feel cared. You feel somebody's caring about you. No, somebody is equally important to know about what is going on in your life. How is your everything happening? So this is very important to have that kind of connection with somebody who can help you and guide you with that. So that's for the questions which have come on the Q&A box. Now let me start answering the questions which are coming on the live in the questions. So first question is from Preeti Mishra. Hello, ma'am. I am in treatment since last 1.5 months almost and following the combination protocol. Many times I see my 3 months old babies fussy after direct breastfeeding for 10 to 15 minutes each side. I also see that nothing comes out on pressing the breast. In this situation, should I try for mid-bottle feeding because I already know breast is empty? I pump after giving him bottle and just few drops come. He anyways takes the full bottle feed. So Preeti, first of all, I would like to know what is the weight gain of the child last week. And is the formula milk decreasing with time? Because I know that you are under treatment of one of my doctor. So if the baby's weight gain is there and the formula milk is coming down, then please don't worry, Preeti. Just keep moving forward. Formula milk coming down and baby's weight is increasing, then you don't need to follow the mid-bottle feeding. You can just, after the feeding session is done, you can just like in the initial time, you can try for breastfeeding, and at the last, you can try for bottle feeding for direct feeding, or alternatively, you can try. And after feeding, you can just express the milk. And also, Preeti, what I remember, because one of the doctor discussed your case with me, there were some issues. I understand, Preeti. What I remember, you are the same one. So Preeti, what I want you, because the direct feeding is not so comfortable for you, I know that. I remember there is some issue. So what I suggest right now, first tell me the weight gain and what is the last weight, and is the formula milk coming down with the weight gain? So if that is happening, then we need to discuss it accordingly. Please write in the box that what is the last weight gain and is the formula milk decreasing or not. Next question is from anonymous attendee. I have tried so much, my baby is not latching. Saw your videos too, but also not it. So I understand. By just saying videos, sometimes it might not help. Please reach out to the latching expert. She will come in live with you and will help you out. Next question is from Ankita Shastri. How to finger latch? Baby is 2 months old and I am under your treatment. I am under treatment. Finger latch, what is finger latch? I am not able to understand, Ankita. Please write it in detail. What is finger latch you're asking? I am not able to understand what is finger latch. Next question is from Modita. Baby feeds whole night 5 to 6 hours. Doesn't sleep. Won't feed for hours. Wakes up after few minutes and feeds for an hour. Sleeps around 5 to 6 hours in a day. 5 to 6 hours in a day. Okay. Ultimately has to supplement with formula. Top up quantity is 20 ml. It's okay, girl. So Mudita, you are saying your baby is sleeping for 5 to 6 hours in a day. So imagine, because babies don't know it is night or day, if your baby is smaller one. So obviously, if they're sleeping in the day, the baby will not sleep properly in the night. We'll keep feeding, because this is obviously in 24 hours, you will see that there is cluster feeding for at least 3 to 4 hours. So what I'm seeing here is the pattern of cluster feeding in the night. Also, the baby is feeding for long hours. If the baby is feeding for long hours, it means the baby is doing an passive feeding. So you need to work on improving the latch. You need to see the weight gain. If the weight gain is on a lower side, then you need to work on the supply and obviously on the flow and latch also, because you are saying that the baby feeds for an hour also. So if the baby is doing what I always tell, how to see the active feeding or not. If you see the gulping movement in the baby's neck, the baby is doing an active feeding. If you don't see a gulping movement in the baby's neck, the baby is doing a passive feeding. The baby is not drinking actively. So Mudita, what I see here, see the weight gain. If the weight gain is on a lesser side, you need to work on supply and flow. And if the weight gain is fine, but only the problem of giving the long feeding hours, then you need to work on the latching. Formula top up is only 20 ml. So if the weight gain is fine, you just need, by just improving the latch, the milk supply will be okay. You don't need to give more. Top up of 20 ml, it can be easily reduced. No issues with that. Next question is from Ashima. I am mother to 1 month old baby. Oh boy, I am having issues in breastfeeding. Low milk supply and shallow latching. I am pumping breast milk and supplementing it with formula, but the amount is less. How do I increase lactation and help my child in latching? So 1 month baby, Ashima, you can definitely improve everything. I have given to you today tips about increasing breast milk supply and about the latch also. But again, with a disclaimer, please see, because your baby is just 1 month old, can be easily resolve everything. Try to work only for 1 week by yourself. If it is not increasing or if it is not improving, please reach out to the team and get your consultation done so that the things can resolve. Next question is from Shreya Elsa. I'm under your clinic consultation. I just started the medicine. I think I've answered your question, Shreya. Breast milk is hardly 10 ml when I pump and baby is completely refusing the breast. You are the one who has just started 3 days back. So Shreya, my answer is just keep patience, keep moving and follow the protocols properly and get back to the doctor. They will help you with the further protocols. Next question is from anonymous attendee. Morning, my breast will be full. After feeding till night, my breast will become empty and milk will not generate until night. Took lactair capsules and powder too, but no effect. I am so worried. Please help me, ma'am. So first of all, how do you know that the breast is empty? By checking, by pressing the breast and seeing nothing milk is coming out, or by pressing and seeing the breast is so soft. No milk, no milk, so soft. There's no milk at all. Pressing, drops. How my baby will, what will my baby get? Leave it. So girls, you have to understand there is something called as letdown reflex. Your brain is very smart. It's a supercomputer. It will not keep releasing the milk like this, like flowing. Otherwise, imagine if the milk will just flow by itself, it will be so difficult for the mother. As you could have seen leaking in few initial, when the baby is born, it becomes so uncomfortable. So once your body gets adapted to the milk, how much milk has to be produced, you will not see leaking, or when you press the breast, it will not show you streams of milk. So that's why please don't worry when you press the breast, there is nothing. When I see the breast are so soft, nothing is there. Don't worry all these things. So what you need to see, if your baby's weight gain is good, please don't worry about you don't have enough milk. Just trust your body, put the baby regularly on the breast. The milk will be there. Don't worry, and don't in a habit of giving the bottle if you feel that I don't have enough milk, because the baby will get habitual to the bottle's flow and will start rejecting your breast, and you obviously are feeling low confident. If the baby will start refusing the breast, you will definitely feel that I don't have enough milk, and then you will start pumping, you will see very less milk, you will start losing your confidence further. So what I suggest here, please don't worry. If your baby's weight gain is good, if your baby is less than 3 months, baby should gain 200 grams per week. If your baby is between 3 to 4.5 months, baby should gain nearly around 120 to 150 grams per week. If the baby is more than 4 months and up to 6 months, 100 grams per week is fine. More than 6 months, you don't require to have 100 grams per week. 50 to 60 grams is also fine. So I've told you today what are the weight gain we need to see. So if your baby is gaining weight properly and it's looking fine and fine. Now regarding lactair capsules, if you just see back of the lactair capsules, you will see preservatives are added into that. I have checked lactair, it has got preservatives. You can just see the back of the strips. You will see that it has preservatives. I don't recommend preservatives for the mothers. If you feel that you need any kind of help in improving the milk supply for any kind of galactogogues, then go for natural galactogogues like lactomagic powder and Morico tablets. And still, if you are feeling that you are not getting help, you have tried for more than 1 week and nothing is helping, if your baby's weight gain is less, then don't worry. If the baby's weight gain is fine, relax. It is all fine. It's all fine. Okay. Just don't press and see. Nothing is coming. Nothing is coming. Don't worry. Okay. Next question is from G. Sri Harsha. How much formula milk should we give to 2.5-month-old baby as a completely dependent on the formula? So your baby should gain around 150, sorry, 2.5, no? So nearly 200, 180, 200 grams per week. So now what you do? Suppose today is day 1. You check your baby's weight. Give whatever amount of formula milk you're already giving till now. After 1 week, you check the baby's weight again. If the baby is gaining around 180, 200 grams, whatever amount of formula you have given in the last week, it is perfectly fine. Now, if you see the formula milk, so if the weight gain is more than 200 grams, start reducing the formula slowly, slowly, slowly. So that, and keep checking the weight gain of your child every week. Don't check every day. Many of you check the weight every day. Hare, Baba, how you do that? Please don't check it before week. So just check every Sunday to Sunday. Just suppose, imagine you are checking the weight every Sunday to Sunday. And if the baby's weight gain is around 2.5 months, and very soon you will start seeing the symptoms of growth spurt. So it is perfectly fine, Sri Harsha, if the baby's weight is around 150 grams. During growth spurt, sometimes babies don't increase the weight also. It is perfectly fine. Once the growth spurt phases pass, then 150 grams per week is perfectly fine. So this way you will be knowing how much formula to be given. Now this was about formula, but I suggest if you can work on improving the milk supply, please suggest and I request, please start working. I know giving formula milk is not a choice of the mother. You would have tried a lot of things, and when nothing worked, then only you started giving formula milk. I totally agree with you. I am totally understanding that, and I'm not saying that you are a, why are you giving formula milk? It's fine. I understand you would have tried a lot of things and nothing working, then only you're giving formula milk. Perfectly fine. But you can improve it. Your baby is just 2.5 months old. You can definitely improve your milk supply. So just don't worry if you have gone through some failed attempts. You would have tried a lot of things. Maybe you would have consulted some lactation consultants also previously. Still, I suggest giving a trial with us. It's, you can give it. You can trust on us. We have been working with mothers since a long time, and don't worry if many mothers sometimes they feel nothing is working. There are a lot of things, there are a lot of factors involved into that. Just come to us. We'll just assess everything and we'll tell you where you are missing the things. And once it starts happening, you will start seeing results. You will start being more confident, and it is all. And lastly, I am not saying that why are you giving formula. I am just saying you can try for it. And I understand there would have been some failed attempts. Please, still I say you can try for it. If the baby is just 2.5 months old, you can definitely try G Sri Harsha. Regarding formula milk, I just told you how to calculate how much formula milk to be given to your child. Next question is from Mudita. What is the ideal weight gain first month of the baby? Initial weight was 3.2 kg. So ideal weight in the first month is 200 grams per week. But in the first month, for first 7 to 10 days, you will see the decrease in the baby's birth weight. So if the baby is born 3.2 kg, you might see a 10% decrease. So the baby would have reached nearly 2.8 or 2.9, which is perfectly fine for first 7 to 10 days. But then the basic thing is by 15th day, the baby should gain the weight back, should be birth weight again, and then start gaining 200 grams per week. Next question is from Mudita. How long should feeding last at 3 weeks age of the baby? Now, 3 weeks is a very small because the baby is very small. The milk holding capacity of the baby is very less. So the baby might take frequent feedings and baby might take more because they are more habitual to sleeping. So first 4 weeks of the life, the babies are sleeping for at least 14 to 15 hours per day. That is the sleep cycle of the child. So if the baby is sleeping more and asking for frequent feedings, it is, first of all, it is very normal. Don't worry at all. You're doing good, Mudita. If you are seeing this pattern, I am saying confidently to you that no problem with that. Now, your question, how much feeding? So what you need to see when you're putting the baby on the breast, just see that the baby's gulping movements are there or not. If the gulping movements are there, your baby is doing active feeding. So you should see that when you are not seeing gulping movements in the baby's neck, you can remove the baby because the baby is not feeding right now. The baby is sleeping. So this way you will be able to understand whether the baby is taking feeds or not. Next thing is sometimes as new mothers, just 1 month old mother, right now you are just a 3-week-old baby's mother. So it becomes sometimes a concern that is the baby drinking? Has the baby got something? Is my milk supply okay? Is the baby getting milk something or just on the breast? So what you can see after once the baby has breastfed, just press the breast and see the color of the milk. If the color of the milk is coming translucent, that means this breast is empty. If your baby seems more hungry, you can put the baby on the other breast. It will help a lot. It will improve the demand so that your supply will improve. Now, if you are seeing the milk coming as thick white, that means the baby has not emptied the breast yet. The baby will not sleep for longer. The baby will ask for frequent feeding again. In that case, now, if you're too tired, you can just express the milk and give it to the child with katori or a spoon. But please, no bottles right now. You're just 3 weeks old baby. Please don't introduce bottles here. Now, If you are not too tired, because with the good latching technique and the way you are sitting and the way you are holding the baby, if that is comfortable, you can feed the baby at frequent intervals. It is perfectly fine. In fact, don't worry if somebody tells you you're feeding baby frequently, you don't have enough milk. Please don't worry, Mudita. Just keep seeing the weight gain of the baby. If your baby is not taking any formula milk, the baby is gaining weight properly. Please don't worry about the frequent feedings and long feeding cycles, because you just need to see the active feeding. So just remove the baby when you're not seeing the active feedings. All these are well, Madhita. I'll be happy to connect if you have any kind of issues further, because I really want all the babies, all the mothers who are just 1 month less, to have good foundation in your knowledge, especially if you know any pregnant lady. This is my request to all of you. If you know any mother who is pregnant right now, please suggest them to reach out to us. We want to give them a proper foundation, so that first 3 days of the after delivery, they should follow the things properly, so that there is no issue with breastfeeding later in the future life. And because we will teach them initially, because during pregnancy we have time to learn things. Once the baby is born, it becomes so difficult to manage the things. So that's why if you know any pregnant lady, please refer them to us, so that we can give them good guidance. And very soon I'm planning to start breastfeeding knowledge sessions for pregnant ladies also. But because right now I have more mothers, new mothers in the community, I am not sure how much people will come in the as pregnant ladies. So you all can suggest me in the emails. If you feel that you know some pregnant ladies, please tell me, because I am really happy to start some these knowledge sessions for pregnant ladies. So that I can give them good foundation about it. Okay, so let's move ahead. So Tanima Bhattacharya says, my baby drinks 100 ml of formula milk per feed on average. If there's no breast milk, if I get 30 ml breast milk, should I give her 70 ml of formula milk? I just said no about it. I just had a discussion on the way shouldn't calculate according to the formula milk. Watch this recording again, and I have given you this information about amount of formula milk should not be calculated with the breast milk. You just need to see the baby's weight gain. And I think your baby is more than 6 months. So the baby would be taking solids also. So that will be very easy for you to see the weight gain and start reducing the formula milk. So no worries with that. Next question is from Toshi Mehta. What if due to gastric issues or diarrhea or anything, he's not breastfeeding? He takes it to the mouth and snatches nipple away towards him and leaves and cries. What to do? He's on antibiotics plus probiotics. Baby is 3 months, 15 days old. So 3.5 months old, if baby is having gastric issues or diarrhea and he's not breastfeeding, you definitely need to give him breast milk. Because if he's having diarrhea and gastric issues, there are chances of dehydration. So if the baby is not breastfeeding, I would suggest you put the baby on the breast. If he is not coming, please maintain the supply by doing regular pumpings or regular hand expressions, so that the milk, you start giving him more and more of breast milk to the baby, so that he doesn't fall into dehydration. Next question is from again Tanima Bhattacharya. If I want to store breast milk for later use, how to do that? I pump 7 times a day. Should I store that milk in 7 separate bottles? The amount I get in one session is around 30 to 40 ml. I think I have answered this also, how to mix them and how to store them. So you can definitely store breast milk on room temperature 3 to 4 hours, in refrigerator 3 to 4 days, in freezer 3 to 4 months. If you have good electricity and you have a deep freezer, you can even store up to 6 months. And you can mix and match. I have discussed about whether you can mix 2 sessions breast milk. Next question is from anonymous attendee. As your team members told to hand express, I get only 2 to 3 drops and 15 ml through pumping. Good. So just keep moving. Just pump as many sessions they would have advised you. 15 ml of milk through pumping and 2 to 3 drops of hand express is fine. Keep moving and keep seeing the weight gain of the baby and see what is the formula milk you are giving. You're doing good. So just keep moving and just see how much formula you are giving, and just tell them when you are having your next call with them. They will be asking you how much formula you have given, what is the weight gain of the baby, and what is the amount of expressed breast milk. So if the baby's formula milk is coming down and baby's weight gain is there, very good. Keep going, girl. Next question is from G. Sari Harsha. My production was started post 5 days of delivery with support of lactate tablets and granules powder. Also, my baby doesn't latch on breast. He has been drinking formula milk, so I used to express milk and used to give about 50 ml per day. As my production is very low, now he's 2.5 months old. As soon as my tablets and powder has been finished, production has been completely went down, and I am getting few droplets. What shall I do for breastfeeding the baby? So first of all, see, always remember, if you are maintaining only one kind of dosage for any medications you are taking, first of all, lactate is a big no. It has got a lot of preservatives added into that. So it's not a big no. Now, when we are talking of any kind of medications, if you're on the same dosage, how will you know whether it is the dosage needs any changes? So what happens, we as doctors, we advise some particular doses to the mother, and we ask the mother to come back to us and tell what is the weight gain of the child, how much formula has been given to the baby, and if the baby has been on direct breastfeeding, how many times the baby is feeding. If the baby is not on direct breastfeeding, then we see what is the amount of pump milk. Now, how we work on this? So we see what is the weight gain of the baby. Suppose we needed 200 grams. If the baby's weight is more than 200 grams and formula milk has come down, then what we do, we change the dosage and we push further. And the supply and the nutrition further. Now, second case scenario. Suppose we don't see weight gain and we see the formula milk has come down, but the weight gain is not there. Then we ask the mother to give more and more of hind milk. We work on that and we change the dosage of the medicines accordingly. Third case scenario, when we see the weight gain is there, but the formula milk has not come down, it is the same. Then again, we change the dosages so that we reach up to that, because formula milk has not increased at least. Baby's weight gain has been there, but formula milk didn't come down, but it did increase also. In that case, we understand, okay, it is working, but we need to change the dosages. So imagine on the side of the doctor who is treating you. So accordingly, there are a lot of factors when we consider. It might look to you, Arey, but doctor, what does they do? They just ask and they just tell. It's not like that. We have to see so many factors about it. What is the weight gain of the child? How much formula milk has been given? What is, if the baby feeding or not? Is the baby mother pumping? How many times she's pumping? There are a lot of emotional factors also when mothers come to us. Ma'am, we couldn't do it. Ma'am, it is so difficult to get up in the night. It is so difficult to pump. I have to sterilize the bottles. There are so many issues with the mother also. So being mother ourselves, we can't just bang them. Arey, you have to do. You have to do. We can't do that. We have to find out something in between. We have to take the mother also. We have to consider the baby also. We need to consider the family also. Sometimes the family is pushing the mother. Arey, you're not getting any results. Leave it, leave it. So there are a lot of things when we have to see all these things. So Ji Sri Harsha, I can understand what you have been going through. So the dosages of the medicines needs to be changed regularly. Sometimes we might increase it, sometimes we might to decrease it. So that will depend on the doctor's discretion and what they want to do it. Second thing, when you are talking about milk supply was there, but slowly it became less. So if it was 50 ml per day, at least you get up to that and then increase it further. You can definitely do that. And once you start seeing milk supply coming back, you will be really confident about it and you can definitely improve it. This is just my suggestion and my advice. Please work on it. Next question is from Samia. My son is 3 months old. He sleeps throughout the night. Also, he was bottle fed twice a day, 3 ounce, since he was 1.5 months old. But now he's not taking the bottle. Hardly drinks 1 ounce. He's taking breast milk although. He's fed every 2 to 3 hours during the day. His birth weight is 2.75 and currently he's 5.5. I feel my breast hardly full if I only breastfeed him entire day. And so I am not sure about whether he's satisfied or not. So 3 months we needed 1.2 more. So 2.75, 3.7 and nearly 4 kgs. Hey, weight gain is fine, na? 3 months. 3 months is 4 3 are 12. 12 weeks. 12 into 2. Achha, 2.4. Okay. So 2.4 into 2.7. So 7, 8, 9, 10, 11, 1, 2, 3, 4, 5. Hey, weight gain is perfectly fine, Samya. Your baby's weight is perfectly fine. Everything is good. And formula milk is decreasing so good. Don't worry your breast is feeling less or not full. Your baby's weight gain is very good. Now what you do, your baby is 3 months. I can understand why you are feeling like that. 3 months is the growth spurt period when the baby demands more. That's why you're feeling like that, Samya. Don't worry, you're doing very good. You don't need any kind of help. You're doing very good. Just keep moving. Your baby's weight gain is on a higher side. I think it is because of the formula milk which you are giving. Start reducing small amount. Start reducing like 10 ml, 20 ml regularly and keep seeing the weight gain. If your baby is gaining 150 grams per week, you're good to go, Samya. You're doing very good. Please don't get disheartened or don't worry about my milk supply is less. I say that you are doing very good. Please don't worry. Keep moving. If you're feeling so less, just have Lactomagic and Moreco. It will be all okay. Do warm compresses and massage and keep seeing the weight gain. If your baby is gaining 150 grams per week, you're good to go, Samya. Please don't worry. Don't doubt yourself. You're doing good. Next question is from anonymous attendee. My baby is 3 months old. Most of your babies are 3 months old. Maximum I see 3 months, 3 months, 3 months. I know because that is a growth spurt and that is a breastfeeding milestone also. That's why you people are having issues with 3 months. Okay. So my baby is 3 months old. Her weight was 2.7 kg at birth weight, 4.5 kg currently. So we needed 2.4, 7, 8, 9, 10, 11, 2, 5.1. No, it is less. Her urine count is more than 6. Her urine count, I am very worried. But she finds difficulty in sleeping for long hours during the day. Her total sleep hours is around 12 hours. Is this happening due to insufficient milk? So if the baby is sleeping for 12 hours, first of all, you don't worry. Your baby is sleeping for 12 hours, a 3-month-old baby. It is perfectly fine. But what I am worried is, I am not worried about urine count. Now, why am I not worried about urine count? When many of you say urine count, urine count, urine count, just think one concept. Your breast milk is made in two parts, fore milk and hind milk. Fore milk is more watery and hind milk is fat rich. If your baby's latch is not well, the baby will drink fore milk only. And so the baby will be peeing good. The urine count will be more, but the weight gain will be less. And that baby will be asking for frequent feedings because he has taken basically fore milk. So, and that is visible from your baby's weight also. See, your baby is 3 months old. So 3 months means 12 weeks. 12 into 2, 2.4. We needed 2.4 in your birth weight. So 2.7 plus 2.4. We needed 5.1. But your baby is 4.5 kgs only. That means that is why the weight gain is less. And that is why the nature is trying to improve the baby's weight. So that's why the baby is finding difficulty for sleeping in the days. You just need to work on the latching, what I feel. Once the latch will be deep, the baby will be emptying the breast properly. And you can even check. I am very sure if you check after every feeding, you will see the hind milk coming out. And I think if you just work on it, it will be improved. Next question is from Mudita. Formula top-ups should be given in which bottles? Any brands are steel bottles better? You just see that it should be a paste bottle feeding. And also when you are giving bottle to the child, just don't hold it this way. There should be no flow, fast flow with that. Just try to have a level feeding, baby's level. So the nipple is full, but you are not like giving like this, like full flow. Just follow that. And paste feeding bottles, they are available on Amazon and OTT channels. Just right there, you will see paste bottle feedings. Next question is from how to overcome from lactose intolerance. So there is no solution when we talk about lactose intolerance. Mostly it is self-limiting. After some time, it will be okay. But you need to just keep checking about it. So in between, just keep giving the things which are normally advisable. And if you don't see any kind of problems, because I'm not sure we are asking about yourself or your baby, because you have just written how to overcome from lactose intolerance. So if it is for you, then mostly it is established because we are adults. But if you're asking about the baby, just keep checking in between. And if you see no problems are there, it will be okay. So lactose intolerance, what I see is just self-limiting sometimes. And for few babies, it might continue later on also. Next question is from Drisha Paryani. Hi, doctor. My kid is 25 days old, and since few days he's sleepy in the day and awake at the night or taking cat naps. Hey, what is cat naps? New terminology you people are bringing. Cat naps. Acha, naps like a cat. So cat doesn't sleep properly? I'm not sure. I don't have a cat. Sorry. Okay. Anyhow, so taking cat naps and he ends up having cluster feed. How to handle colic issue as well? Arey Baba, इतने सारे questions. So पहले तो 25 days old. Since few days, he's sleepy in the day and awake at the night. or taking catnip. So it's fine now. It is just 25 days old baby. He will obviously have more. He doesn't know about day and night. So will be obviously like no proper sleepy patterns, and they are sleeping for 14 to 15 hours for first 4 to 6 weeks. So it is perfectly fine. And he ends up having cluster feed. So cluster feeding in 24 hours for 3 to 4 hours in once in a day is perfectly fine. So if the baby is taking cluster feeding for 3 to 4 hours in 24 hours in the initial 2.5 to 3 months, it is perfectly fine. How to handle colic issues? So just give tummy time to the baby. You can have some hing paste applied and then do warm compresses on the baby's tummy. And so do some exercises with the baby's legs, just like having bicycle and all those things which are suggested by our elders also at home. And it will definitely improve, Trisha. Next question is from Nishad. Doctor, please suggest me the best diaper rash cream for my infant. Hey, I'm not a pediatrician. Come on. Diaper rash cream. Achha, what I used to use for my kids, that was long back, that was a rash cream. It is even coming these days. So you can have a normal rash free cream. Abhi to it has become so easy. It comes easily in the market. But I am not sure about the best diaper rash cream. This is what I remember with my kids. Next question is from Preeti Mishra. Ma'am, baby's weight gain is fine. 200 grams in last week. My question was in Google Sheet regarding how much breast milk baby gets with direct feeding, as he still seems to be taking the full bottle after feeding 10 to 15 minutes each side actively. I am waiting for the day when I would not need to offer a bottle after breastfeeding. So, Preeti, if the baby has gained 200 grams in last week, also please write age of the baby, and is the formula milk decreasing or not? You need to write that also. Because if the weight gain is good and the formula milk has started reducing, you are doing good, Preeti. Please don't worry. If the formula milk is coming down and baby's weight is maintaining, we are good to go. Please don't worry. So imagine if you keep doing the same way, formula milk is coming down, baby's weight is increasing, then you're doing good now. Slowly the baby's formula milk will be down, zero, and weight will keep maintaining. That means your milk supply is good. Okay? So please write what is the formula milk you have given and what is the age of the baby. Next question is from Nishad. My baby is latching only for just 5 minutes and he is frequently pooping after every feed. If the weight gain is good, I am not worried about it. Frequent pooping with breast milk is perfectly fine. But just see that the weight gain is there, because if the baby is dehydrated, the baby's weight will not increase. Next question is from Preeti Pandey. I have a low milk supply. Please tell me what can I do, doctor? मैं Cetavrix लेती हूँ with milk. So प्रीति, आज मैंने बहुत सारी चीजें बताई. आज आपने शायद लेट ज्वाइन किया, 8:45 पे मैसेज किया, इसका मतलब आपने टाइमली ज्वाइन नहीं किया था प्रीति. इसकी रिकॉर्डिंग देखना, कल परसों में यूट्यूब पे आ जाएगी. यूट्यूब चैनल मेरा डॉक्टर तनिमा सिंगल के नाम से डालना, वहां पे है. और मैं बहुत सारे वीडियोस रोज डाल रही हूँ, शॉर्ट फॉर्म वीडियोस. उसको सब्सक्राइब कर लो, जिससे आपको रेगुलरली, और वो बेल आइकन दबा दो. मैं यूट्यूबर की तरह बोलती हूँ. प्लीज सब्सक्राइब एंड पुश द बेल बटन so that you get regular notifications. Fun. Next is from Nishad. I am taking Lactair tablets and Galact granules powder. Is there any side effect for the above product for me or my infant? Please see. Lactair tablet or a Galact granule, just go and see the back. It has got preservatives. If you're okay with preservatives, I have no issues to sell you. Next question is from Himali. My 7-month-old baby didn't breastfeed since birth. How can I breastfeed to him? I have already answered about this a lot of times. Just try mid-bottle feedings and start reducing, like do a lot of skin to skin and all that. Ankita Shastri, in last call, ma'am suggested to try bring baby to the breast and so use finger to put in baby's mouth to practice sucking. Latching finger is the word she used. I am a bit confused what I need to do. Yeah, same thing. Because sometimes they are not habitual to the skin. That's why they do that. So just bring the small finger to the mouth, and once the baby starts latching, then remove the finger and take the baby back to the breast. It's already 1.5 hours. Okay, girls, I still see some questions are there, but it becomes so difficult next time. So please, I would suggest, please write your questions in the next call. It's already 1.5 hours. I need to go. So I'll answer next questions. Please just whatever questions are left, we'll take it in the next Q&A round. Please write your questions with you. And in the next call, we'll discuss about it. If you have something very emergency, have a call. It is booked in, it is there in the Q&A box. I'm just putting them all again here for all of you. You can save the links, but we'll connect next week now, girls. Okay, it's already 1.5 hours. It becomes so difficult sometimes. So there are some links in the chat box. You can reach out to the team. Many questions are still there, and I see a lot of questions. So it is already 1.5 hours. You can just copy our questions. We'll discuss them next week. Take care, girls. Bye bye.